Doctor, it felt like someone had grabbed hold of my heart and was squeezing the life out of it, doctor.
How long was this squeezing?
About 5 to 10 minutes.
And what were you doing when this happened?
I was driving around with my colleagues, doctor, socializing.
A little car o par. Huh?
Yes, doctor.
Car o par.
But, you know, I normally don't drink so much, but yesterday I cracked this sensational case
How many
on
drinks did you have?
about 7 or 8.
7 or 8. And were you on an empty stomach when that happened?
Yes, doctor.
Empty stomach. What is it? Come in.
Doctor, the auditors are waiting here, doctor.
Ask them to wait, no?
Okay, sir. Doctor, they're saying they cannot wait because they have a meeting with the director in 1 hour, doctor.
Tell them I'll see them after this patient.
Okay, sir. Sir, nothing.
Where were we? In high spirits on an empty stomach. Am I right?
Yes, doctor.
And let me take a guess. You woke up with a hangover this morning and you took an aspirin. Am I right?
Yes, doctor. How did you know?
Aspirin. And let me take one more guess. Aspirin has been your favorite fix for hangovers. You've tried all sorts of things, but nothing works like aspirin. Am I right?
Yes, doctor.
Aha. Thought. Gilly gilly do. Aha. Young man, it's not your heart that you need to worry about. It's your drinking. Okay. You have an acute case of gastritis caused because of your excessive consumption of alcohol and aspirin.
But doctor, I've had gastritis before and this felt nothing like it. You know, my heart felt like it was an ashtray with cigarettes stuffed in it.
See, gastric pain can feel that way, very similar.
What about angina?
Angina? You don't have angina.
But just as a check, doctor,
I don't think you need to worry about things.
Excuse me, doctor.
What is it?
Doctor, the auditors are asking how long will this take, doctor?
Tell them that I will come outside
Okay.
before their backsides go cold on that bench.
Okay. Sir,
What is it?
sir, should I really tell them this, sir?
Tell them what you like, but don't keep coming in and going out like this again and again.
Sorry.
Take these pills for a week. Okay, these are antacids. Your pain should subside. Okay?
doctor, I've had gastric pain before and I'm quite sure that this was angina. You know, I've been informing myself over the internet that this.
The internet. I was on the internet yesterday. There's this pill that could reduce my weight by 3 kgs. Should I buy it? What do you think?
No. Look, over the years, I've really learned to trust my hunch and my hunch tells me that this was to do with my heart.
Look, you might not like what I've been telling about your drinking, but see, like it or not, the problem is not with your heart.
But don't you think we should get some other tests done?
No.
Something at least, ECG, angiogram, something at least, doctor.
No, you don't need these things. You don't need an angiogram.
But it won't harm. Just one.
Don't come in.
No. Budget, doctor.
Oh, what budget? State budget?
No, the hospital budget.
What about the hospital budget?
Doctor, the auditors have asked me to tell you that since the hospital budgets will be decided today, if you don't give them inputs, they won't increase our budget, doctor.
Okay. Tell them that I'm terrified by this threat of yours.
Yeah.
Okay. And my knees are shaking like right now. And if this continues, I'm going to take twice as long as to come over and meet them.
Okay.
So get out.
Sir, nothing.
Doctor, about that angiogram, see, there's this.
How long do you want to live?
What?
Tell me, how long do you want to live?
1995, I guess.
Look, I've checked your heart. It's going to pump you well for a good 3/4 century long. So take these medications and go home and forget about it.
But how can you be so certain, doctor?
Hey, what do you mean?
I mean, I'm the one who felt the pain. How can you dismiss how I felt about it?
Point where your spleen is.
What?
Go on, point where your spleen is.
I don't know.
Keep your left hand over your left rib cage. Keep it. It's there.
Okay. Look, doctor, I might not know the human body as well as you do, but I certainly know how I felt.
Look, feelings are overrated. In medicine, we work with facts.
Oh, well, speaking of facts, do you know that a recent study in the US indicated that the top 3 reasons for death was heart disease, cancer, and medical error?
Are you questioning my professional competence?
I'm a journalist, I question everything.
Well, then, here it is. Take this. Here's my professional opinion. You can take it or leave it.
How dare you say something like this? When it's a question of life and death, how can you make such a careless remark?
Look, I don't have all day to sit and argue with you. I have a lot of patients waiting outside.
And what am I, not a patient? You owe it to hear it to me. I've paid you a fat fee.
Oh, well, then I'll have it refunded now. Come on, leave.
You can refund my money. But what if all this turns out wrong? How will you refund that?
But do you know the number of patients who are waiting for me outside? There's one patient whose heart collapsed yesterday. She doesn't get a transplant in a week. She's gone. There's another patient who had a heart attack just this morning. Now you tell me, where do you and this pain of yours stand in the scale?
So is this how you see us, doctor? Dots on a scale? How about as seeing us as human beings?
Stop wasting my time and please leave.
Oh, I will remember to not treat a fever chart a cancerous growth, but a sick human being. Wasn't this part of an oath you took, doctor? Or maybe you took some other oath, a hypocrite's oath perhaps, right?
Okay. What do you want from me?
I want you to listen.
I mean, I've heard you.
You have heard me, now I want you to listen.
Potatoes, potatoes.
It's not the same thing.
Well, look, you've wasted enough of my time already. Come on now,
Better
please.
your time than my life, doctor.
I want you to get out now.
This amounts for medical negligence. You do realize that, don't you?
Look, if you are not leaving, I'm going to have you thrown out now. Come on, leave.
You do that and you see what I'll do. I'll make headlines out of you. Cardiologist of the year treats patients like germs and washes them off his hands.
Look, and if you do this, I'll make sure neither you or your family are seen in any hospital ever again.
You arrogant scoundrel! You're nothing but a goon with a stethoscope.
Now get out.
How dare you do that? I'll expose you. I'll make sure you never practice again.
Oh, go bluster somewhere else. Go.
How dare you do that? You squawk! Cancer of the medical profession, you! I'll expose you!
Psycho! You hypochondriac! You need a psychiatrist, not me! Don't even think about it!
Doctor! Doctor, the patient collapsed on the way, doctor.
Oh my God. Look, ask the nurse to prepare the emergency immediately. I think he's had a heart attack.
Oh, God.
Move quickly.
Sure.